Often a question that we get a lot with clients here, and probably a growing area of concern, is related to the visual system. So a lot of our clients are coming in and they're having difficulties with catching a ball. You'll see them like close their eyes, not able to track it. You'll also see difficulties with handwritings, where they're placing their letters on the line, the spacing between words, between letters, and even their size control. And a lot of times these kiddos are having underlying visual difficulties. So what that kind of means for your kiddos is that acuity-wise, their eyes see perfectly fine. They're 20/20, if not better. But their ability to coordinate their muscles in their eyes to work, to visually fixate on objects, to track them through their environment, this is where it's kind of getting a hiccup. So kiddos, for example, when they're reading a sentence or a paragraph, you'll see them read, but what you would read straight across, their eyes are jumping from point to point. So this is visual tracking difficulties. So they'll lose their place a lot. And then kiddos who struggle with saccades, when you jump from one line to the next line, the accuracy of their eyes jumping from point to point is off. So often they'll go too far down, too far up, and so they lose their place a lot. And you'll see them use their fingers to help, or even putting like overlays on the paper helps. So these are kind of things that we look for when we do evaluations. We're looking for the ability of their eyes to move smoothly, tracking objects from jumping point to point. And we also look at convergence. So this is the ability of the eye to track things in and then to track things out. This really comes into play with school, because when you're looking at a board, your eyes are focused. Then you come to your paper and your eyes have to converge to focus on the paper. So if the kids are having difficulties with the convergence, they won't be able to look at their paper, and it'll take them longer to find their place on their paper, or sometimes one of the eyes can struggle and they'll actually start to shut off that eye and just use one eye, so then they start to lose depth perception. When we do the evaluation, we look at this and we kind of look at how it relates to the sensory system. Are they having vestibular issues related to the sensory? Is it contributing to the eyes? Is it postural control? We start to kind of break down and work on those skills, and then if there's something that's going on a little bit more than what's in our field, we definitely refer out to vision specialists to help in that area as well. And we work very closely with vision specialists in the area to help coordinate so that we're both addressing the same areas and we're really helping those kids succeed.